There's a number of series that have been done where they've followed patients with GvHD and looked at the various systemic complications, whether it be oral or GI. And in these different series, it ranges from what I can tell, anywhere from about 25% to about a third of the patients who have known GvHD will have concomitant ocular GvHD symptoms such as dry eyes. There's a spectrum of irritation. So usually people don't know that they have, or they know they have ocular problems because their eyes burn, or they feel like they have rocks in them, or their vision decreases. And the problem is that they get their life back through the bone marrow stem cell transplant. But as they go through and they make their way back in this journey, their eyes can become the rate limiting factor or the quality of life factor that is limiting for them. And so many patients will come and maybe they've had dry eyes before, but it gets ramped up with GvHD. The symptoms, as I mentioned, can be just dryness, burning, light sensitivity, the feeling of foreign bodies in their eyes due to something called filaments that form on the corneas. And in rare situations, they can have corneal infections and ulcerations because of the breakdown of the surface of the eye. The skin of the cornea doesn't heal, and they can get superinfection and develop infectious ulcers. So that it's really important for patients, if they have these symptoms or there's an increase in the symptoms or their previous symptoms from when they have GvHD, to seek eye care or let their oncologist know about these. The reason many patients can't see well, other than if they've developed a cataract, which is on the inside of the eye, due to a systemic medication that they may have had to use for their graft-versus-host disease, would be that they have ocular surface irregularity. That is, that the surface is dry, it's pitted, and those decrease the ability for the cornea to act as a very smooth, convex, reflecting surface. The cornea needs to be smooth in order to bring light to focus on the back of the eye. If it's not, you get glare, and that will cause decreased vision. It also causes very debilitating light sensitivity and pain because the nerves are raw. So if we cover those with a contact lens, then you are replacing the front surface of the cornea with a normalized surface, and you're covering raw nerves with a Band-Aid, if you will. And those two things are huge in terms of the ability to help a patient's quality of life. With soft contact lenses, however, they may not be able to stay on the eye. They are high water content devices, and by putting one of those onto a dry surface, the water will be pulled out of the contact lens and dry out and stick to the surface of the eye. And that can cause other problems that you'd rather avoid. So there are now scleral lenses which don't touch the cornea.